Brought to you by New Jersey Sharing Network.
Welcome back to New Jersey Capitol Report. I'm Joanna Gagis. I'm at the Liberty Science Center right now for the official announcement of the merger of two major hospital systems in the state of New Jersey, Hackensack University Health Network and Meridian Health. I'm joined right now by Bob Garrett, who is the co-CEO, along with his counterpart, John Lloyd, who we'll talk to in just a moment. Bob, welcome.
Good morning, Joanna.
What was the impetus for this merger between these two major hospital systems?
I think it was the realization that we had two great healthcare organizations, and by putting those two together, we can really deliver even better and more improved quality care to the residents of New Jersey. We'd be able to provide better access to care for the residents of our state, and there could be some opportunities to gain some efficiencies where we can actually save the healthcare system some dollars as well. In addition to that, John Lloyd, my co-CEO, and I have known each other for 25 years, with a lot of mutual respect for each other and for our organizations. They really complement each other in a lot of ways. There's a lot of mergers out there in healthcare that I think organizations just merge for the sake of getting bigger in terms of size and scale. This is about certainly getting bigger, but it's more about what each organization can really offer very distinctly. Each side really brings something unique to the table. Hackensack with its clinical platform, its academics and its research, and Meridian with its continuum of care. I think that's what makes this merger so significant and so special.
You know, Bob, it's interesting. Oftentimes, this is an atypical merger in the state of New Jersey. Oftentimes, you mentioned we've seen hospitals merge for various reasons. Many times it's because one of the hospitals is not on solvent financial footing. That's not the case here.
Not at all.
So how does it work when you take two systems that are financially solvent and you merge them? Why is that beneficial, and how does that work?
Well, both systems, and you're absolutely correct, are strong both from a clinical perspective, an organizational perspective, and a financial perspective. I think it just makes for a much more successful merger, because when you have one entity that's let's say taking over another entity that's financially struggling, a lot of the focus will have to be on that struggling entity. In this case, the boat will float to the top, because we'll be able to really keep our focus on all of our hospitals, all of our non-hospital businesses. There won't be a specific area where we're going to have to address more heavily than not, and it'll give us the opportunity to grow and to provide new services and programs for the people of New Jersey.
Bob, what do you say to those who say, as the hospital system gets larger, it creates more of a challenge to provide quality of care, to manage that quality of care? How do you respond to that?
My response to that is, think about the sharing of knowledge and sharing of best practices that can occur between two great healthcare organizations like Meridian Health and Hackensack University Health Network. That knowledge transfer doesn't happen when you're independent. So I take issue with that. I think actually the quality of care will be improved, and we're seeing it already, where our clinicians are speaking to one another. We're going to be developing system-wide service lines. So if you're an orthopedic patient, you will have consistent service, consistent quality standards wherever you receive that particular service throughout Hackensack Meridian Health. That will improve quality. That won't take away from it. So I would take issue with that. I feel very strongly that the quality of care will actually be significantly enhanced by the merger of these two organizations.
Hackensack has really been at the forefront of these kinds of partnerships, Meridian Health and also Seton Hall University. And there's a new medical school that was announced earlier this year. New Jersey does not have a medical school. What is the academic impact? What is the economic impact of the state that you'll expect us to see?
It's so significant. By creating New Jersey's first private medical school, it will be a real game changer for the state. So we're going to have, for generations to come, a supply of physicians. There's now a shortage of physicians. It's predicted that it will grow worse in the state of New Jersey, and for that matter across the country. We're going to have a supply of physicians for generations to come.
What do we know about physicians who have their residency in a state? What do we know about that?
So if you receive your medical education and your residency within that state, you're twice as likely to stay in that state and practice medicine. So what we're hoping to do, one of the major goals of this new medical school, is to reverse the talent drain that is
brain
leaving
drain.
the state now, and we're going to give priority to in-state residents for this medical school. We're also going to give priority to those that want to practice in one of the areas where we find ourselves in short supply, like primary care or general surgery. So this will have a huge impact on the state from a manpower perspective, from an economic perspective, and I think that's why you're seeing such great support throughout the state for this new medical school. It's one of the few issues, I think, in the history of New Jersey that's actually received bipartisan support.
Terrific, Bob. Thank you so much.
Thank you, Joanna.
I'm joined right now by John Lloyd, co-CEO of Hackensack Meridian Health. Welcome, John.
Thank you, Joanna. I'm happy to be here.
We're happy to have you. This is exciting for the state of New Jersey. It's a transition in healthcare, a lot of which has come from the Affordable Care Act. We look at really the mandates to serve the population away from a fee-for-service model. How do you feel, John, that this merger is working to that end?
Well, both of our organizations understood the changes that would come about because of the Accountable Care Act, and both of us took the same approach, and that was to get involved. And as you probably know, we both have done those demonstration pilots with the ACOs and other things. We also at Meridian did a 4-year palliative care demonstration pilot. All those are designed to help us and our physicians better understand what we have to do to deliver higher quality and lower cost.
We hear the term population health used a lot. What does population health mean? Why is that really the undercurrent of this new system?
Well, population health is really a concept, and it has to do with providing more services out into the community where we can better care for those patients and not be so hospital-centric.
So away from that acute care setting?
Yes. And an example would be at Meridian. For many years, we've developed a continuum of care. We're in over 100 locations in Monmouth and Ocean County with all of our vast ambulatory services.
Explain what you mean by that continuum of care.
Simply, the continuum of care is all the non-hospital services being part of this vast continuum. So if you look throughout Monmouth and Ocean County, we're in over 100 locations, and we try to put an ambulatory service conveniently located in every part of Monmouth and Ocean County.
You know, John, these are two major hospital systems within the state. Each have their own culture, each have their own identity. What are the challenges of merging these two corporate cultures into something that feels consistent for the people who you serve?
The interesting thing about our two organizations is our cultures are very similar. We work with McKinsey, a consulting firm. We've been working with them for probably the last 6-7 months. And one of the things they did is they did a cultural audit of Hackensack and Meridian. And when they got the results, the senior leaders questioned the analysts as to how could those results be that good. And it turned out that both of our organizations were in the top decile in terms of culture. So,
Are you telling me this was easy?
well, no, it's never easy. Maybe lucky, or maybe just having the right partner. But what's amazing is our cultures are very, very similar. And that is one of the key reasons that I think we're going to be successful. And in fact, what we want to do now is we want to combine our services, and we've been working on that, and reach more people in our respective communities. And if you look now, we go pretty much from up into New York State all the way down to Atlantic County.
You mentioned in the press conference earlier today that there was a real cost-saving effort on the part of both organizations to make sure that you entered into this as fiscally sound as you possibly could. Explain what went into that and what cuts you were able to make.
Well, each of us had done this separately. We weren't doing it together. So at both Hackensack and Meridian, for the last 2 years, we've each taken out about $125 million out of our organizations. And that's not easy to do. But both of us have done that successfully over the last 2 years. And part of our strategic plan moving forward will be to, again, reduce costs. So we'll probably come up with a new plan, maybe a 2-year plan. And not sure what that number is going to be, but it's going to be significant.
Hi, I'm Peter Rooney. In 2006, I lost my father to renal disease. He was on the waiting list for a new kidney, but did not receive one in time. Unfortunately, so many like my father have lost their lives while waiting for a life-saving organ. At New Jersey Sharing Network, we're committed to saving and enhancing people's lives through organ and tissue donation and by informing people about this important decision. Because you can make a difference and save a life.
Also brought to you by Summit Medical Group, Seton Hall University, and by the New Jersey State Nurses Association and the Institute for Nurses.